Sure. How you feeling?
I'm feeling okay.
How was your the numbness in your fingers?
Numbness is not too bad.
Okay. Do you feel like that's improved overall?
Honestly,
surgery.
Possibly a little bit, but I'm not entirely sure because
Sometimes it's hard to tell. Yeah.
Because the numbness with the right arm was one of the lesser symptoms.
Yeah.
The bigger symptom for me with the right arm was always the pain in the elbow.
Right.
And
how's your pain right now?
I still have it, but
is it a different type of pain? Or
it's like more. It's numb now, and it's tighter.
Right.
And it doesn't get inflamed as bad as it used to. It's still like a chronic thing, but I can brush. Like I can't remember so many times where I haven't been able to brush my teeth, and I did have those cases before. A lot often before.
Right.
So
it probably sounds like to be more muscular here. It's a different type of pain because the pain that you felt before with the nerve being pinched behind the medial condyle here.
Yeah.
That we move that nerve to the front and bury it underneath the muscle so they can be protected right there. You know, it's called submuscular transposition. And does it hurt at all when I press in here?
Not there, no.
Good. You can extend it fully. Can you bend it to flex your elbow fully? Good.
Now, yeah.
I
have tried. I mean, just recently, since weightlifting has always been, or just working out has been a way to relieve stress, and I haven't been able to do that for over a year because of this. And so just recently, I just tried getting back into it, and it does cause pain.
That's your hand here.
But I've been, and I wouldn't lift it over the. I tried just lifting it 90 degrees.
Right. Do these feel the same or different?
I think it's the same.
Good. Can you open your fingers for me? Don't let me close them. Good. So very good strength in the muscles that are supplied by the ulnar nerve right there. I think this is all basically some residual kind of soreness in the muscles due to the muscular origin and not a nerve thing. Okay. And so I think that some therapy may be helpful here to do some strengthening exercises.
That's one thing I was hoping to get out of it is a prescription for the therapy.
I think that's the best next step for it.
Cool. And
are you taking any anti-inflammatories for your pain?
I really just stopped doing it because it just didn't seem to
do anything for you. Yeah. Let's do the therapy for you.
Okay. And another new thing is, I mean, it's bilateral though, and I did have it before, but I have it more now, and I think it's because just recently I tried getting back to the computer work a little bit, and very bad chronic chest pain in both areas. I guess that's something does that tell us anything, or is that just kind of go with cubital tunnel syndrome?
I don't think it goes with cubital tunnel syndrome, and it's really chest pain.
It feels like under the armpit.
Your pecs
under the armpit.
It
feels like it's under the.
Okay, I mean that's where the nerves are coming underneath here. Okay. And through your armpit, and so the brachial plexus, a bunch of nerves goes in here, under your collarbone, under the muscles here, and in your armpit, down like this. But you have this on both sides, so this could be,
I know it's not surgery related, obviously.
No, it's not surgery related. But that's something that also can maybe help with therapy. You do postural exercises, in case this is something called TOS, thoracic outlet syndrome. But especially if you have bilaterally, it could be more posturally related. Because it's not like you're just going to hunch over on one side.
Yeah.
So let's try the therapy for that too.
Okay. And then I saw my orthopedic at SCOE. This was a while ago, and it was kind of to follow up about the neck, and also just get some opinions on this.
Right.
And so I did have a slight herniation between C4 and 5 before any of the cubital tunnel syndrome. Could that have had anything to? Okay, so that's done. And then can I just ask your opinion on, do you know what cervical traction is? Because you said that could be a possible thing.
Yeah, I've heard of it. Basically they try to pull up on your head and stretch out the neck, and increase the spaces, the neural foramina where the nerve roots. And it may or may not. Okay. Some people it does help. They really believe in it. Other people it doesn't work.
Do you think that has? So the neck is really not, even though it is they're both chronic symptoms, but they're not
chronic things
directly related, or
I don't think they're directly related.
Okay. Cool. Let's see what else. Is it possible to get a prescription for an occupational therapist? Does that exist?
Well, that's what I was going to send you to.
Okay.
For both shoulders and for your elbow.
Okay. So the physical therapy includes like some kind of occupational therapy.
Oh, occupational therapy.
Yeah.
Oh, well, in my mind, occupational therapists are the best kind of hand upper extremity therapists.
Yeah, I believe that.
So let's do that.
Okay.
Yeah. OT. I'll give you twice a week for 6 weeks.
Thanks. And can I get I guess to get that, can I get copies of like all the? Do you have like notes for the
give you like my office report
and that
whatever we have, I'll give you.
Okay. Do I talk to her after
something else afterwards? My assistant Javier.
Okay. Is there any medical study that I can be a part of? Like with this, like I'm just curious how this works because obviously the more data everybody has, like.
Not that I know of right now.
Why not? It's.
There've been many studies done. Yeah.
I mean, it would make sense though to let's see, like wouldn't everybody learn from that better? Like if if everybody's surgery reports went to some like database that all doctors.
That's the Holy Grail.
Yeah. Why? God.
If we can do that, it's too hard to design and execute a study like that. Yeah.
Oh gosh, it would just be a system, a simple system. I don't know. Okay, sorry.
Yeah.
I just wanted to. Is there any doctor that you know of that does that kind of thing, or
a lot of academic institutions they do studies like that.
But they don't make it.
But you have to enroll patients. You have to have a well-designed study. You have to make sure you have. It's a lot of work. It's not just you're collecting data. It's actually a lot of work.
To make the system.
Follow up. And you need baseline scores versus post-op scores and stuff like that.
Okay. Surgery with. Okay, and then with the left, I still have left's about. Well, obviously it's the same, and it is kind of more like classic cubital tunnel, in that the numbness is the main and pain in the wrist.
Right.
The main symptoms, but I also have pain. But for the left, this up here is the bigger symptom.
Okay.
Thoughts on do you think that is worth trying to treat?
There's your nerve right there. Tenting up right there. Okay. If I tap here, do you feel any shocks when I do that?
Yeah.
You do going into your finger?
Actually, no, I didn't feel it. It just
right there.
Yeah.
Open your fingers for me here. Don't let me close them. Nice and strong. Good. Okay. Seems like classical cubital tunnel symptoms. You can do the splinting at nighttime. Nerve tests, and if none of that works, then decompressing and do the same thing.
Possibly. Okay.
Yeah.
Okay. And in the prescription, can we treat both?
Yeah.
Okay. Surgery with the left. Okay, that's. And yes. And can you just show me exactly where the nerve is now?
Yeah. Right on the nerve is right in here.
Okay.
Probably right there.
Interesting. Because what's interesting is I still have the pain down here.
Down there? No, and I hear that from some patients, even though the nerve is no longer there anymore.
Yeah.
But it could be related to the other structures there that are supplied by these other tiny little nerves.
Okay.
It's still sending kind of pain signals to your brain. Yeah.
So since it doesn't, if it's down there, it's probably not the ulnar nerve.
Not the ulnar, I don't think it's the ulnar nerve.
So what could how could we treat that then? Is it tennis elbow or golfer's elbow?
Does it hurt in here?
It's very it's tender. Yeah, it's more down there.
More down there.
Yeah.
That's that wouldn't be golfer's elbow or tennis elbow. It's not an epicondylitis.
Okay. It is. Yeah, it's a lot of.
Yeah. I've never figured out what causes that pain.
Okay. Because with mousing and that's the, and then another big thing is driving that causes the chest and the everything.
Driving?
Yeah.
I would definitely see a therapist and get some advice from them and do some exercises for the bilateral TO, the possible thoracic outlet.
Okay, so the PT will help.
Yes.
What was it? TO? What was that?
OT.
OT?
Yeah.
Okay,
TOS.
Yeah.
Thoracic outlets.
Do you think that's...
It could be.
Okay, and the PT will
probably
be able to figure that out?
Yeah, right.
Okay. Yeah, okay. Thank you
Okay.
very much.
No problem, man.
Very much.
Yeah, follow me when you do that prescription.
Okay.
And,
sorry, just one quick question. Is like, do you think would Celebrex or Vicodin or
Celebrex, not Vicodin, but you know, an anti-inflammatory can be helpful, like Celebrex. I can give you some if you want. Yeah.
That would help.
Sure.
You think?
I'll give you some.
Okay. It's
you don't have any self-allergies, right? Okay.
No. And insurance doesn't cover that, Celebrex? Is there any?
They don't cover that for you?
No. Is there a
okay.
Is there a another version, like a generic version?
No.
Okay. Is there any other way?
It's either you can do a Aleve, Motrin, Advil, that kind of thing.
Is that okay?
Yeah.
God, you got so much information. I just want to make sure I got it. Oh, epidural injections? Would that have any...
I would get worked up for your cervical spine first before you even think about that.
Okay.
Yeah.
I had one before the cubital tunnel thing, and it seemed to help the neck pain a little bit.
Okay, I'm the wrong guy though to talk about that.
Okay.
All right.
Thank you very much.
Sure.
Do I...
yeah, follow me.
Okay.
Yeah.